I will now pass you through to Beth to introduce herself, her work, and her presentation.
And thank you for the invitation. I am very excited to be here. I wish I was in Australia in person. I was hoping for that in-person thing, but next time. My sister lives in Oz, so I love your country. It's beautiful. And this is a topic that is incredibly important to me. I'm calling this the mental health code card, and you'll understand why by the end of my talk. And I really believe that psychedelic therapy is a very important part of how we improve the odds of surviving cancer for my patients. I am a board certified general surgeon specializing in oncology surgery of the breast. I'm also board certified in integrative and holistic medicine. And I have a certificate in psychedelic-assisted therapies and research from California Institute of Integral Studies, from MAPS, and from Synthesis. So I kind of went all in when I decided to dive into the psychedelic pool. I still am a practicing surgeon and still actually do breast cancer surgery. But you're going to see after the next 35 to 40 minutes that for me, this is really, I've found my niche, I think, in how we really help patients heal. All of these are places that I've either practiced or went to college and gotten my advanced degrees in. And this is me, the surgeon. I've been a breast cancer surgeon for almost 40 years. And as such, I spent a significant portion of my time in the operating room. But I don't heal my patients in the operating room. I simply cut out their cancer. And in 1996, I believe, I started my board certification training in integrative medicine, started first as a Reiki practitioner, and then realized the amazing aspects of integrative medicine and how we could utilize integrative medicine to actually kind of rewind and treat the root cause of disease in the physical body. For the past 10 to 15 years, have been working in the electroceutical industry using technologies that stimulate the vagus nerve, and recently technologies that provide low-level, extremely low-frequency electromagnetic fields to help the physical body heal and also the mind. And then that brought me to my world of psychedelic therapy, which is a little bit newer. My entrance into this space started in 2020. And I'll tell you a little bit more about that later. And now I have been spending a significant portion of my time educating my colleagues in Western medicine to understand that psychedelic therapy is not something that is fringe in healthcare. It's something that needs to be part of healthcare. And I know I can't cut out the patient's fear when I cut out their cancer. That I know that 100%. And for the 4 million breast cancer survivors every year, it's the fear of recurrence and death that is pervasive for them. And that leads them to this place of what I call an existential crisis. And existential crisis it's when thoughts about life and death just are constantly rolling through their brain, almost like a ticker tape. And it's more of an existential plight. And it stops people from really like living their lives to the fullest and being able to cope with the changes that cancer brings. And this is where I call this is where the mental health code card comes in, because in medicine, if someone has a cardiac arrest, the code card rolls in, everyone in the room knows exactly what to do. There's a protocol, who puts in the IV, who's pushing the drugs, who's doing chest compressions, who's breathing, who's intubating. But unfortunately in cancer, with this existential crisis, there is no protocol. There's no immediate, okay, this is what we do. But when patients are in that place where they're floundering in life, we don't see this in their labs. We don't see it in their imaging, and we can't tell by the stage of their cancer. But healthcare built a system to save hearts, which is wonderful in the acute care setting. But we haven't done anything to really look at how do we save someone's soul who's been diagnosed with cancer. And I see it all the time. I bring patients back to the office when they've completed their treatment. And I do that for a specific reason, not because they need to have a checkup by me, but I need to know, how are they doing psychosocial, emotionally? And when a patient says, I don't know how to live like this, like I've lost my hair, my breast doesn't look like it used to, my marriage is strained, my partner doesn't understand what I'm going through. How do we help our patients in these situations? And this is where cancer leaves many, many scars. And most of them other people can't see. And I've said this for years that many women are more affected by losing their hair than they are by losing their breasts because their hair is such a visible sign of cancer. And what I have come to find is that to improve the outcome of cancer, it's not just about cutting out the cancer and alleviating what's in the physical body. It's about looking at the nervous system and the soul and not just focusing on the tumor, because we have an opportunity to make a huge difference in our patients' lives. And this is where survivorship, or how someone does after they've gone through their treatment, if they stay in this place of existential plight where they don't feel safe and they've lost control and they're living with a constant fear of recurrence, they get into sympathetic activation. They're in chronic cortisol storm. They get sleep disruption, which again breaks that pattern of healing, immune dysregulation. And eventually, a lot of patients end up with depression and anxiety, which is a little bit different than traditionally looked at depression and anxiety. And this is not that they're psychologically weak. It's that they are in this state of neurobiologic emergency. Like, how do we help them get their nervous system back into shape to be able to heal? And the vagus nerve, to me, is one of the most important overlooked nerves of the body. We are looking at mental unwellness in our breast cancer patients because whether they had it before or after cancer, if they have it before cancer, it's escalated and it increases. And if they didn't have it before cancer, it's going to show up almost across the board. So this is where we look at the sympathetic and parasympathetic nervous systems and the vagus nerve as the bridge to healing. We need our sympathetic nervous system to survive. If you don't have your sympathetic nervous system, you can't run from the saber-toothed tiger. But if our parasympathetic nervous system is not intact and we can't actually get our bodies to rest and digest, we don't heal. So in cancer, we see patients have a decreased heart rate variability, which is the distance between two heartbeats. That is incredibly important and very much connected to survivorship. We see increased inflammation with IL-6 and tumor necrosis factor alpha. And we also see increased cortisol dysregulation. And these are things that need to be addressed in order to help someone begin to heal, because no one can heal if their body still feels like it's under threat. So if they're constantly in a shake, and I say this is, the shaking is like synonymous with a little very short-skinned poodle or short-haired poodle after a nice little bath. They stand there shaking and they just can't get warm, but their body needs regulation. So one of the first things that I've looked at in healthcare before psychedelic therapy was breath. Our breath is medicine. Breath work. It's very inexpensive. Everybody has their lungs. We all have our breath. And we're starting at the bottom of the code card here. We're starting in the bottom drawer because we're going to go for the simple things first that actually can help us set the nervous system. The transcutaneous vagus nerve stimulation is an amazing technology, and we are just about to present our preliminary data at the American Society of Breast Surgeons because this is such an important piece of survivorship. And the areas of the vagus nerve is very superficial, where it courses through the ear canal and along the anterior, the carotid artery sheath, where the carotid artery and jugular vein are located. And so before we can really help someone transform internally, we've got to get them regulated. And this is where I am able to bring together my 15 years of bioelectric medicine and neurobiology, which was one of my undergraduate degrees, to bring the body back into a state of regulation. I learned from a yogi from India who I have known for years. His son, Ishan Shivanand, actually came to the US and did research on various techniques of deep breathing, meditation, and he has a program called Yoga of Immortals. It's an incredibly powerful process. I've done it myself. Unbelievable numbers in decreasing depression, anxiety, insomnia, and improving quality of life. The problem is when someone is already in a state where they are so depleted or They have so much trauma trapped in their body. Getting someone to commit to an 8-week program twice a day is almost impossible. But this is one of the things that I'm very excited about, that once we get someone to that place, there are many techniques like this to be able to help keep them there. And that's going to build your resilience. The non-invasive vagus stimulation technology that we studied at our hospital, Redeemer Health, also used acupressure point stimulation. And Dr. Yakov Katznelson is a neuroscientist and anesthesiologist from Russia. And we did a study basically to look at enhancing well-being. We weren't going for clinical depression, anxiety decrease, but it was a side effect that we were very happy to see. We did an open label study with 60 breast cancer survivors, 50-minute sessions stimulating the vagus nerve and the acupressure points in the ear. We did PGWBI, the WHO-5. We used the NCCN distress thermometer because most cancer centers in the US use that as a metric. And we used the PROMIS fatigue gradient and the Morin insomnia. And what we found after 5 days of 50-minute sessions was highly statistically significant data on improvement of well-being and decrease in fatigue, insomnia, and decrease to stress. We were really pleased with the findings, and we actually are submitting our paper for publication. So they only got 5 sessions, but 12 weeks later, we had long-term continued benefit from those 5 days of treatment. So we were able to prove sustainability. We were also able to look at heart rate variability and the LF-HF ratios between pre-treatment and post-treatment, showing that we had an increase in heart rate variability in our patients. So if you look at the statistical significance and the rigor of this study, everything was highly statistically significant. It's non-invasive technology, and stimulating the vagus nerve, we've known through breath work that it works. We've known through yoga that it works. This is an opportunity for us to potentially bring this to cancer centers and help patients through their initial cancer journey. Another technology that I've recently been introduced to is called ion cyclotron resonance, which is a technology that uses extremely low frequency Tesla frequencies. And they've been shown to be effective in depression and PTSD. It's non-invasive. It's a wellness technology that's coming. It's been available in Italy and Canada, and we are going to be doing clinical trials in our cancer patients in the US as well. So let's get back to the basics of this. We're really addressing this existential core crisis. And the reason that I choose to use a cardiac analogy is that not everybody has the same internal traumas. Not everyone has the same crisis going on. It's not just the diagnosis of the cancer. Just like when we give MDMA for a veteran, so many of these veterans go back to their childhood traumas that were the actual inciting incidences that needed to be healed. It wasn't, it may have been what got them to go in harm's way to pick up a gun and go and fight, but you've got to be able to address the root cause. So when we're addressing the core crisis, I call this the arrhythmia of the soul. And it happens to be the title of my next book, but it makes sense because if we look at the heart rhythms that we treat with medications and sometimes with a code card, we can do the same thing if we look at different aspects of psychological wellness and mental unwellness. And what psychedelics are able to do are able to, what I call reorganize the meaning, bring back that meaning in life, which people often lose. And one of the reasons this is so important is this study was a meta-analysis that looked at antidepressants, so using SSRIs for major depressive disorder compared to placebo in AIDS, HIV, stroke patients, and cancer patients. And what we found in this study is in cancer patients, antidepressants perform about 40% of the time. And this is the rate of a placebo. And unfortunately, they don't usually last long term. And anyone that takes a deep dive into looking at many of our psychiatric drugs, most of these drugs were only tested for 8 weeks, but people are kept on them for years and years and years with escalating doses. But what specifically got me with this is that they're not even effective in cancer patients. So when my patients get diagnosed with cancer and they end up going to their primary doctor and they're put on a SSRI, that basically flattens their affect and it's not treating the root cause. The other thing that I didn't know until I got trained in psychedelic therapy was the effect of adverse childhood experiences. It was one of the first things that when I was being trained at CIS and we were talking about ACEs scores, I didn't know what an ACEs score was because as a surgeon, I stage cancers and I talk to patients about how I'm going to surgically remove them. And I can't surgically remove the trauma that a person has had from their childhood. And this is where looking at ACEs scores should be absolutely 100% become part of the intake with our cancer patients. It should actually be part of the intake of any primary care doctor because the level of increase in PTSD and anxiety with high ACEs scores, suicidality, suicidal ideation, chronic disease, and a decrease in life expectancy. Like we should be knowing this and we should be addressing this and healing those traumas that these individuals have suffered. In breast cancer specifically, 80% of women have PTSD, flashbacks, detachment, numbness, a lot of changes in their relationships. And I didn't know what PTSD was until I actually got to experience it myself. And I'll tell you a little bit about that in a bit. But if I only had a tool to cut it out, and I've asked every medical device company I work with, make me a tool that removes the fear when I remove the cancer, but no one's been able to do that. So recently I did a big lecture on the vagus nerve, and I did not realize it until then that SSRIs actually have an anti-inflammatory mechanism. They reduce inflammation by suppressing tumor necrosis factor alpha, IL-6, and IL-1B. And in this case, it's probably why they may be working. And sometimes we know that depression is not a lack of serotonin, and SSRIs may increase the amount of serotonin in that presynaptic space, but we know that it's probably not working the way that they initially thought it was meant to work. This is a really interesting study. It came out this week, March 18th, and it was a meta-analysis of psychedelic therapy versus antidepressants under equal unblinding conditions. And what's interesting is I always go to look at the authors and see if they have any conflict of interest, meaning do they have ties to pharma? And they do. You can go do it yourself. I'm not going to throw anybody under the bus here. But what they concluded was there's no superiority of psychedelics versus antidepressants, and short-term outcomes were equivalent. But the reason that they say this is a lot of these studies, when they look at these studies comparatively, they think that because someone knows they're getting a psychedelic, you know whether you got a placebo or psychedelic. It's kind of hard not to know. And so they believe that expectancy is driving outcomes, which inflates the psychedelic results. But what they don't talk about in this meta-analysis, which I thought was really lacking, is that this is the difference between suppressing a symptom versus a neural reset. It's a difference between managing a symptom and helping someone heal. And it's the difference between a chronic medication that someone will take most likely for many more years than the company's ever tested for versus an episodic transformation. And so, they did not talk at all about long-term durability, relapse data, no side effect comparison, and no quality of life comparison. So one of my breast surgeon colleagues sent this to me and said, you're going to want to see this because it's a really important study. But to me, all it did was say that, it's the way that they're looking at this meta-analysis to try to prove that they're equal in what they do. And my opinion is that they are not equal, but I'm entitled to my opinion. The nervous system isn't secondary to healing. It is central to healing. And psychedelic therapy addresses the nervous system. It addresses our default mode network. It addresses everything that has to do with that unsettling in someone's core that keeps them from feeling safe. So I had to learn to bless the thing that broke me down and cracked me wide open. You can Google this on the nightly news. I worked in a health system where I uncovered the fact that many women had a delay in their diagnosis of cancer, and pretty much tried to get my health system to make some massive changes, and they didn't want to change, so I had to change and I left. But it was that experience of the PTSD that I experienced every single time I walked into the office and saw a patient that was, her cancer had been missed, and I wasn't allowed to tell the patient that their cancer was missed because I was an employee of the health system. And the physiologic effects it had on me were just unbelievable. And it was the one thing that took me out of the space of, I don't do drugs. I thought that psilocybin, and I couldn't even spell psilocybin. I thought that all of these were illicit drugs and not to be used, because I grew up in the, this is your brain on drugs, the eggs on the frying pan. But it led me to do a psychedelic journey, because I thought that LSD was evil back in the 70s and 80s, until I read How to Change Your Mind by Michael Pollan. It happened to come into my space in December of 2019, right when I was at the peak of my PTSD with my health system. And that was when I had the arrhythmia of my soul. And it led me to a place where I changed my mind by having a psychedelic experience and saw every imposter in my life. It was an absolutely mind-blowing experience. And it also led me to a place where I got introduced to the psilocybin studies out of Johns Hopkins. And Bill Richards was actually one of my mentors at CIIS. I got to meet Roland Griffiths while I was still alive. And it brought me to a place that took me not just for my own personal healing, but I dove in and I went and got trained and got more certificates than Carter has little pills, because I needed to learn, how can I bring this to my patients? Because if this had such a profound effect on me, and seeing the effect that it had on cancer patients, I wanted to help bring it to the world. So in my code cart is a drawer full of psilocybin, because it is one of the most beautiful Teonanacatl gift from the gods. I took my first group of breast cancer survivors and medical professionals to Mexico to experience the sacred mushrooms with indigenous healers. It was a 5-day retreat, 2 sweat lodges, 2 journeys, an amazing transformative experience. One of the women in the group was going through metastatic cancer, and she was getting her Western medical treatments, but the experiences that she was able to heal from her childhood during this retreat, I believe, have also just not helped her physical body heal, but her emotional body as well. So this year, there's supposed to be a 6 behind that 202. January 2026, took another group of 13 women for a 5-day retreat. Absolutely amazing, transformative, wonderful. We climb a mountain, which is physically challenging. We go jump into a freezing cold waterfall, which is very cleansing. Did 2 Temescal sweat lodges, which just help to ground and bring people into that sacred space. Did yoga as a group. And then we had 2 journeys, one with cacao and a small dose of mushroom, another one with a larger dose of mushroom, with 2 Atomi healers who bring the lineage of this beautiful, beautiful medicine. You know, this process for me has been wonderful. We do medical screening, psychological screening, getting people off their medications. What was beautiful is that from the first year's group, people that had been on SSRIs, that we had weaned them off to be able to do these ceremonies, utilizing the Mind Vibe, using the Vegas technology that we just did the research on. We used those bioelectric technologies to help wean off the drugs. And we've actually been able to keep these women off the drugs and keep them keep their nervous system stable. The psilocybin for me it's a beautiful molecule. I think it's wonderful in breast cancer patients. The reason I like to do group retreats is because there is something very special and very elevating of the process by bringing these women together in group. When clinical studies were done with patients in stage 2 and 3 breast cancer, the people that had community, the people that had that connection did better. And ironically, my granddaughter while I was in Mexico on a retreat, did her first yoga class. And my daughter-in-law took this beautiful picture of her positioned very nicely between the mushrooms. So I think she knew where her grandmother was. And someday when she looks back at that picture and sees this talk on YouTube or whatever they're going to call it, then she's going to go, wow, my Baba was very cool. So this was one of the last days. We were doing an indigenous dance with our healers. And to be able to, decrease death anxiety, to improve meaning in life, to be able to help alleviate the existential crisis and also the sustained discontinuation of SSRIs. I think these are all like amazing outcomes to be able to come out of a 5-day retreat and also, sustain connection to these other women. And, they don't just feel better, they see differently. They see things differently. Their lives look different. And it has been incredibly fulfilling for me. I know that when I first did all of my training, I thought I was going to be doing a lot of research in psychedelics, but right now I'm very much, very, very happy in my space where I'm working on this mental health code card from vagus nerve stabilization to psychedelic transformation. My third book, which will come out hopefully by the end of this year, is called Arrhythmia of the Soul, and it really is going to be a compilation of stories of healing from people, not just from psychedelic therapy, but using bioelectric medicine to stabilize the nervous system, to help get patients off of some of their SSRIs and things that they're not thriving on, and to bring them back to a stable place of health. So other things that we have in our mental health code card that are so important. Ketamine therapy cannot be underestimated. It's a beautiful compound used in the appropriate set and setting. Again, for a person who has suicidal ideation in the ER, I think it should be top of mind. I'm hoping that the United States can get smart like Australia did and not make MDMA live in a drawer tucked away or have it be underground, because it is a beautiful molecule that can help people's hearts open and to bring them to a place where they can actually heal their PTSD. Never tried LSD. That was before my time and after my time. But some of the studies that are ongoing with LSD are just absolutely mind-blowing. And I think that it should be in our mental health code card as well. 5-MeO-DMT has been part of many veterans' journeys, along with ibogaine. And 5-MeO-DMT, sometimes called the God molecule, where have not experienced this one, but from what I'm told, a lot of people have the same experiences, and they actually come out the other side with just profound transformation. I started my psychedelic journeys early on with ayahuasca training. I went and did ayahuasca with one of my professors from Synthesis, and really had a beautiful experience. There's a lot of ways that people are getting ayahuasca these days, not doing it through an indigenous process where I'm going to say sometimes sketchy situations. I had participated in ayahuasca in 2 different places, one that was very commercial and one that was indigenous. And I will tell you that the difference was night and day for me. When it was very commercial, the guardrails are not up. I did not feel as though that set and setting is good for someone who truly has trauma to heal. I call it an ayahuasca tourist at that event, which the main thing I got out of my first ayahuasca experience was learning to surrender, which is kind of tough for surgeons at times. And then there's ibogaine, and iboga is really for that ventricular fibrillation. And sometimes you need the defibrillator to turn that off, and which is why ibogaine needs to be given in a clinic setting that has appropriate medical attention, because the arrhythmia in that person's soul, to me, is akin to ventricular fibrillation, and you've got to have the appropriate technology there. And for me, psychedelics they're not here to treat my patient's cancer. They're here to address the human who's diagnosed with cancer and how they go on with their life. And so in my mental health code card, there is a place for pharma. Short-term SSRIs, ketamine, obviously there's a place for pharma. For vagus nerve regulation, I think that bioelectric medicine is so important. the FDA has approved implantable devices for treatment-resistant depression that have had wonderful success. Transformation and internal healing through ketamine, psilocybin, ayahuasca, iboga, TRTP, multiple different avenues to attain healing. And then integration is so important. And from where I started at the beginning with breath work, I think that breath work needs to become something that all of us work on. It's something we can teach our patients, and it's how we can overlay each piece in this code cart to make this a stronger process. And we've got to get the body to feel safe enough to repair. And so I chair quality, safety, and reliability for my health system. So I'm always safety first. So our code cart really has to maintain levels of grounding, calming, and using the vagus nerve for regulation, making sure we have community and therapeutic alliance with connection, like the appropriate set and setting, the appropriate preparation, the safety, and then utilizing psychedelic therapy to bring meaning back into someone's life, to get that spiritual integration, and then continue on with integration and purpose alignment in life. And again, when the body feels safe, the healing will happen. And so the future of integrative oncology, I see it as we've got to focus on the body, mind, and spirit at the same time. We've got to do ACEs assessments at the time of diagnosis. We can use autonomic metrics like HRV and phase angle to see where our patients' bodies really are living. We have to look at mental health as a variable in what we treat our patients, educate them in breath work, and then use psychedelic therapy and plant medicine when appropriate. So we've got to treat the nervous system, not the tumor. And once we do this and we align the nervous system, we align the brain and the heart. And to me, this is where MDMA, which is the heart opener, and psilocybin, which is absolutely creating those new neural pathways. I think Australia's got it coming and going right now because you guys are absolutely on the right track. And so when your next patient looks at you and says, I don't know how I can live like this, what are you going to be empowered to reach for in your mental health code card? And this is a view from my home in Sedona, if any of you ever come visit, because we all must be the change we wish to see in the world. And my second book, Shifting Gears, just came out, which talks a bit about my psychedelic journey and how I shifted in my practice. And God willing, by the end of this year, Arrhythmia of the Soul will be in somebody's hands as well. So I really appreciate the opportunity to have all of you this evening, and anyone that chooses to watch this on the recording. You can find me on social media, and I'm going to stop sharing and open it up to questions if anybody has any.